Okay. Hey, I'm Kristen. I'm going to do a physical assessment on you today. I'm going to wash my hands and start by just looking at your skin all around. Everything looks good. It's warm to touch. Good skin turgor. Okay. And I'm going to take a look at your head. Come towards me just a little bit. There you go. Head is normocephalic. I'm going to be looking at the color of the hair, consistency of the hair, any infestations, indentions, anything like that, and everything looks good, no abnormalities. And then I'm going to palpate your temporal arteries. It's good, 2+ bilaterally. Then I'm going to go for your lymph nodes, preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular, and no lymph nodes were palpated. And then I'm going to move to your ears. Ears are symmetric. I'm going to palpate the penis and tragus. Any tenderness?
Nope.
Ears are symmetric. No tenderness. I'm going to take a look. I'm going to turn your head this way. Pull the ear up and back. Just looking at the tympanic membrane. It's pearly gray. Do the same thing on the other side. Tympanic membrane. Pull it up and back. Pearly gray. It's good. I'm going to assess for cranial nerve number 5. If you can clench your teeth for me. And close your eyes and tell me where I touch.
Cheek, forehead, nose, chin.
Okay, cranial nerve number 5 is intact. And then cranial nerve number 7. If you can open your eyes. If you can puff out your cheeks, pucker your lips, smile, frown, and raise your eyebrows. Okay, cranial nerve number 7. And now I'm going to assess for hearing. If you can occlude one ear for me. And just repeat what I'm saying.
1, 2, 3.
And the other ear.
ABC.
Okay. And then tell me if you hear this in both ears or just one.
Both.
Okay, good. And then I'm going to time this and tell me when you stop hearing this. Just say now. Whenever you stop hearing it.
Now.
Okay, and the same, I'm going to do it.
Now.
Okay, and I'm going to do this bilaterally, and by timing this, air conduction is greater than bone conduction, and that is cranial nerve number 8 intact. So now I'm going to move to your eyes. I'm looking at the eyebrows, the lashes, the palpebral fissures. I'm going to pull, you can leave them open, pull them down. The sclera is white, conjunctiva is pink. There are no lesions or discharge. So no abnormalities. And then I'm going to assess for cranial nerve number 2. If you could close one eye for me, or hold your hand over one eye. And read this line.
OLCF.
Okay, and with the other eye?
OLCF.
Okay, good. Vision is 20/20 bilaterally. And then taking a look at my nose, tell me how many fingers I'm holding up.
2.
And this is assessing for peripheral vision. I don't know if I can see. Look at me again. Same thing on this side.
2.
Okay. Peripheral vision is intact. And that is cranial nerve number 2. Now I'm going to assess for cranial nerve number 3, 4, and 6. If you can just look at my nose, follow my finger with your eyes without moving your head. Okay, and the pupils constrict with convergence. And now follow my hand again without moving your head. Follow my finger. Okay, and that's conjugate gait. Next, I'm going to check the pupil response with the light off. Okay, and then just leave your eyes open. Good. And pupils respond to direct and consensual light. So that is cranial nerve number 3, 4, and 6 intact. Then I'm going to move to your nose. If you can hold each side and breathe in and out for me. Okay, other side. Okay, and then I'm going to palpate your frontal and maxillary sinuses. Any tenderness?
No.
Okay, good. Okay, now I'm going to move to your mouth. I'm going to be looking at your teeth, your gums, your tonsils, your uvula, your soft palate, and underneath your tongue. So if you could just open up and say ah. Okay, the uvula and soft palate rises symmetrically. Stick your tongue out and move it from side to side. Okay, good. The tonsils are grade 1, and that is cranial nerve number 9, 10, and 12 intact. Okay. Then I'm going to palpate your carotid arteries on each side. And they're 2+ bilaterally. And then I'm going to listen for any bruise. So just hold your breath for me. Okay, you can breathe normal. No bruise heard. I'm going to check the trachea, make sure it's midline. And then I'm going to come behind you and have you swallow for me. Okay, and that's palpating the thyroid. Shrug your shoulders against my hands. Okay, that's cranial nerve number 11 intact. Okay, now I'm going to have you sit in this chair and face this way. I'm going to assess the chest now. I'm going to assess the back and the front. There's no accessory muscles. You can breathe normal. No accessory muscles used. No masses. Anything. Now take a deep breath for me. Okay, the chest rises and falls symmetrically. And then I'm going to listen to your breath sound. So anytime you feel me move my stethoscope, just take a deep breath in. Starting above the subclavian. Okay, now I'm going to listen to the lateral lung fields. Okay, good. Lung sounds are clear bilaterally, no adventitious breath sounds. Okay, every time you feel my hand, I'm going to check for tactile fremitus. If you could just say 99.
99. 99. 99. 99.
Okay, good. And vibrations were heard bilaterally. Okay, next I'm going to check for egophony. Anytime you feel me move my stethoscope, just say E.
E. E. E. E. E. E.
Okay, good. And an E sound was heard, which is normal. Same thing. I'm going to just, every time you feel me move my stethoscope, say 99.
99. 99. 99. 99.
Okay, good. And it was muffled, and that's bronchophony, and that is a normal finding. And now I'm going to do the whisper test. If you could just whisper 1, 2, 3 every time I move my stethoscope. Okay, and I didn't hear anything, which is also a normal finding. Okay, now I'm going to have you turn around. And now I'm going to assess the front of the chest and listen for Lung sounds, or I'm sorry, first we're going to do tactile firmness. So again, 99.
99, 99, 99, 99, 99.
Okay, and vibrations were felt bilaterally, so that's normal. Okay, and we'll listen to lung sounds in the front. Just deep breath each time you feel me move. Okay, good. Lung sounds are clear. No adventitious breath sounds. Now I'm going to move on to his heart sounds. Just breathe regular. So this is the aortic, the pulmonic, Erb's point, tricuspid, and the mitral. And I'm going to leave it here at the mitral for 1 minute to assess rate and rhythm. And it's a normal rate and rhythm with no extra sounds. I'm going to do the same thing with my bell. Just breathe normal. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And now I'm going to palpate the mitral, the PMI, for 1 full minute. Okay. Now I'm going to move to your abdomen. If you could lay on the couch for me. Okay, I am going to look for any heaves and lifts, and there are none. Oh, one more thing. Can you sit up for me just a little bit? I'm sorry. Look to your right for me. Okay, and then to your left. Okay, good. And there's no JVD. One more thing I forgot to do. Red light reflex. I'm going to watch the red light reflex into your corneal optic disc, I'm sorry. And the optic disc is yellowish pink in color and round. Okay, now you can lay down, sorry. Okay, so no heaves or lifts noted. I am going to listen to the heart again while he's laying down with my stethoscope and my bell. Make sure. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And then again with the bell and my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And there are no bruits or extra sounds. Okay, then I am going to inspect the abdomen. There's no visible masses. The chest is midline. Nipples are midline. I am going to listen to your bowel sounds. Starting with the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, then I'm going to palpate. I'm sorry, percuss. Okay, and that's normal. Renaissance is low. And I'm going to palpate and deep palpate. Tell me if you have any tenderness in all 4 quadrants. Any tenderness? Okay, no. Now I'm going to deep palpate in all 4 quadrants. Any tenderness? No. Okay. And now I'm going to palpate for the liver. If you could take a deep breath in. Okay, good. And then the spleen. Good. And the liver nor spleen are palpable. Okay, now I'm going to listen at the aorta, which is a little bit left of the midline above the umbilicus. And then the left renal artery, right renal artery, right iliac, left iliac, right femoral artery, and then the left femoral artery. Okay, and sit back up. Come sit back in the chair backwards for me because I need to percuss your chest here. I'm just going to percuss the intercostal spaces. And Renaissance is low, which is a normal finding. So now I'm going to assess for CVA tenderness, right at the bottom of the rib cage. Any tenderness?
No.
Any tenderness?
No.
Okay, good. Okay, now you can have a seat back here, sorry. Okay. Now we're going to assess for neck extension and flexion. So if you could extend, flex, lateral flexion, which is ear to shoulder on each side. And then rotation. Okay, good. Push your head against my hand. Good. And strength is 5 out of 5. Now I'm going to take a look at all of his joints and his fingers, wrists, elbows, and shoulders. There's no warmth, no redness, no tenderness. Put your hands out like this for me. I'm going to check capillary refill in all the fingers, and it's less than 3. And then radial pulses bilaterally, which is 2+ bilaterally. Okay, now I'm going to check your fingers. If you can flex them, extend, abduct, adduct, and then finger to thumb, opposition. Good. Okay, and then your wrist, if you can flex, extend, hyperextend, extend, and then hyperextend. Good. Okay, ulnar deviation and radial deviation. So kind of put them straight and turn them. Okay, that's good. Then I'm going to check your elbows. So if you can flex, extend, hyperextend. Okay, and then I'm going to check your strength in your bicep. If you could just push up against me. Good. And then back against my hand. That's for tricep. Good. I'm going to check for bicep on this one. Good. And then tricep. Good. So strength is 5 out of 5 bilaterally. Shoulders. We are going to do flexion and extension, flexion, extension, hyperextension. So flexion, extension, hyperextension. Okay, and then we're going to go abduct, adduct, internal rotation, external rotation, and circumduction. Okay, and if you could push your arm up against my resistance, good, and then down. Good. I'm going to do this bilaterally. Up. Good. And then down. Good. Strength is 5 out of 5 in the shoulders. Okay, now we're going to do cerebellar rapid rotation movement. If you take your hands and do like patty cake as fast as you can. Good. And then finger to thumb, opposition, backwards and forwards as fast as you can. Good. And then close your eyes. Spay your fingers. And then put them together. And then out. And then together. Okay, good. Now I'm going to test for sensation of your upper and lower extremities. If you could close your eyes. Tell me if this is soft, if this is dull or sharp.
Dull.
Okay.
Sharp.
Okay, and I'm going to do your lower extremities as well.
Sharp.
Okay.
Dull.
Okay. And now I'm going to assess for sternocleidosis. If you could open your hand, keep your eyes closed. But I put something in your hand and close it. Tell me what that object is.
Golf tee.
Okay. And then I'm going to take this hand with your eyes closed and tell me what number I'm writing in your hand.
8.
Okay, good. Okay, now I'm going to move to your lower extremities. I'm checking the toes, all of the toes, the ankles, the knees for any warmth, redness, swelling, edema. Everything seems to be good. I'm checking all the toes for capillary refill on both sides. And that's good. It's less than 3 bilateral. And then I'm going to assess, let's see if I can pull your foot up, the dorsalis pedis pulse and the posterior tibial pulse bilaterally, and they're 2 plus bilaterally. Okay. Now I'm going to check for reflexes. Brachial ulnar reflex. Good. Bicep. Good. Tricep. Good. Patellar. Good. Achilles. Good. And then the Babinski's reflex is intact, and that's going to be bilaterally. Okay. So for your toes, if you could stay your toes. Good. That's adduction and abduction. Put them together. Flex them. Kind of like take your toes and flex like that with your toes. There you go. Flex them and then extension. Good. Okay. And then we're gonna check the range of motion in your ankles. If you could rotate. No, that's okay. Okay, and then so we're gonna flex like this, extend, hyperextend. Extend it. I think that's just flex and extend. Okay, and then dorsiflex. So you're gonna go up against my resistance. Good, and then plantar flex against my resistance. Good, and we're gonna do that bilaterally. Good. Strength is 5 out of 5. Okay. Move to your knees. So we're going to do flexion with the knees. You could just kind of bend both of your knees. Okay. And then extend to a standing position. And then hyperextend. Okay, good. Now I'm going to check your hips, hip flexors. There's no swelling, redness, tenderness. Okay. So we are going to flex out.
Do I have to hold it?
No, just flex out. And then flex. Extend forward. And then hyperextend backwards. Okay, good. And then we're gonna
knee up and
yeah. So we're gonna abduct. out, and then adduct, cross over. Cross over, abduct. Okay, good. And then rotation. And, oh, sit back down for me. Sorry. If you could, I'm going to check the strength in your knees. If you could just kind of, yeah, there you go, against my resistance though. Okay, good. And then the same one. Okay, good. Strength, and the knees are 5 out of 5. Back up. Okay, turn to your back here for me. I'm checking the spine, its midline, and then bend over forward for me. Now I'm going to assess for any scoliosis, and the spine is straight. No scoliosis noted. Okay, so that's flexion. Extension, flexion, and then hyperextension of your spine, kind of back. Good. Okay, turn this way for me one more time. And then I'm going to ask you to put your heels to heel and close your eyes. Okay, good. That's the Romberg, and there's no swaying. And then walk away. This way. Walk away heel to toe.
Walk away from you.
Yep. Okay, good. Now come back. Okay. And then hop on one foot. Okay. And that concludes my assessment.